tort reform is, equally what it is not, and then for you, Dr. Bianchi, if you'd be kind enough to share from your experience as a physician why you believe tort reform is so vitally important to true healthcare reform, and curiously, why it may have been missing from any and all current policies that have been put on the table.
Well, tort reform in Illinois, for your a little background here, basically what the physicians, the Illinois Medical Society has tried to do on several occasions is limit the amount of damages that can come out of a case for pain and suffering. They would not limit those kinds of damages that were directly related to costs that you incurred or that you would incur in the future, just the pain and suffering. Now keep in mind that in every case, a medical malpractice case is like playing Monday morning quarterback. You're looking at it not in the light of the situation as it occurred, but in the past, and everything has got to be perfect. Now, doctors are individual proprietors, just like maybe you and I are. Their whole estate, it could be at risk with one of these cases. Nothing, I think, scares a physician more than a medical malpractice case, whether it is justified or it's not. And as a result, what you do is the average physician is not going to take any chances. I'm going to order every test that I need to order so nobody can say that I cut any corners in this care. Believe me, the aggregate cost to the system is enormous in that. Now, how does this happen in Illinois? Believe me, the Illinois Trial Lawyers Association put a tremendous amount into judicial campaigns. We had the biggest, most expensive Supreme Court race in the United States because finally business in this state said we've had enough of this, and in Southern Illinois they went head to head with the trial lawyers, and each side spent over $2 million in a Supreme Court race. And supposedly there isn't a Republican or a Democrat form of justice. There's just one way to tell what the law is. But that's what's going on in this state, and we had, up to 3 years ago, we had neurosurgeons leaving in droves. You had OB gynaes leaving in droves, and we would have had a lot more physicians leave if we hadn't had some break in the insurance rates. But I'm sure Doctor will give you a lot more insight than I.
Yeah, I mean, this whole insurance issue is a major problem. For 3 years, I've been trying to find a physician to work with me because my associate is part-time now she had her child, and I can't find one. Malpractice costs are way too high, and they continue to escalate. It's one of the worst in Illinois, in the whole country. Now, it's really kind of ludicrous if you think about it. If we're trying to save money and do healthcare reform and not address malpractice costs and tort reform, let me just give you an example. Our President Obama is very keen on owning car companies to make them more efficient on gas, right? Well, could you imagine, though, doing all that work to be more efficient on gas, but have a hole in the gas tank? What progress can you possibly make? And yet, that's his healthcare reform. Let that just drain the system out, make it where it can't sustain itself. Why? Because of greed. Easy money is out there. And it's just set up to put physicians at parade. No question about it, there are bad physicians out there. But let me tell you, there's a lot more frivolous lawsuits than there are credible ones. And that costs money to everybody, and we all have to pay for that. So that demoralizes physicians. Do you think after 20 years of practice, I want to lose my home? Where am I put my kids in college? All of that? That's just a major problem. So physicians are discouraged.
So, Doctor, if I may just to follow up to that then, how much of your practice, practically speaking, and to those of your peers, do you believe are directly tied into practicing defensive medicine?
Well,
1 minute on that, please.
Well, it's really hard to say how much, but I will definitely say that every patient encounter that you have, you don't skip. When you think you could, you just don't. So, how does that translate to dollars? That's really hard. Now, granted, no, I shouldn't skip on anybody start skipping, but there's just this overkill that there tends to be. You come in with a bad headache, I think long and hard. Do I need an MRI? Because I just missed that one, I'm dead meat. Dead meat. So I've got to really talk myself out of the MRI rather than what I should be doing is talk myself into it. Oh, this headache is just too frivolous, I don't need an MRI. I got to talk myself out. That's the wrong way.
And why should he talk himself out of the MRI? Do you think he's going to get a letter from the government saying thanks?
Oh, well, thank you very much. Gentlemen, thank you.